Hello, this is Chuck, and in this video I'm going to demonstrate how to use patient education in ECW. So you can see here I have a progress note open for a patient. I am using a test patient, so any information you see here is not real patient data. Now I'm going to scroll down to the treatment window. You will see that I already have an assessment in fibroids. I put that diagnosis in so that we could see how the patient education recognizes diagnosis codes that are already in the note and tries to suggest relevant material. So if I click on treatment window will open, and at the top of the window you see this button that says education. If I click on that, the top option in this drop down is patient education. Now the patient education in ECW is run through a third-party database. It's from Healthwise. It has a lot of different documents in here, so there's a lot to search through, but it may not have what you're looking for. So you can search and try and find it, but you might not be able to find it. In here, you can see that based on this diagnosis code of fibroids, it recommended these 6 or 7 different documents, and I can take a look at them. If I click on one, I will see the preview on the right-hand side, and I can read through it before I actually either print it or send it to the patient's portal account. You can only send it to a patient's portal account if that patient is web-enabled. So I'm previewing it over here, and if I like it, I can either hit the print button or I can hit the send button. Doing either of those will let me print or send it to the portal account, and it will also make this count for this patient towards the meaningful use measure for patient education. If I were to hit print here, it will give me the pop-up, do you want to document this? All this will do is in the treatment window, it will print this message. So if I say OK, you'll see that uterine fibroids after your visit material is printed shows up in the progress note. Now at this point, if I want to print it, here's my print icon. I can click on that, and the printing prompt will show up, and I can choose my printer from there. Now I'm not going to print it, but from here, all you do is hit that print button. So I'm going to cancel, and I'm going to close here. If I wanted to send it to the patient's portal account, I can use the send button instead. When I hit send, it will tell me that it sent it to their portal. I'll hit OK, and then it will ask me again if I want to document it. So I'm going to say yes, and a very similar thing. Instead of saying it was printed, it just says that it was published to the portal. So that's just using the suggested education. If I wanted to do something else, I can either do a new search by clicking on the next tab and entering in any search term. So you can see it found the, when I typed in self-breast exam, it found breast self-exam. So if I click on that, I'll get the preview over here. And I can read through it, and if I like it, I can send this or print it as well. I'm going to go ahead and send it to the portal. Again, either sending or printing both count for the meaningful use measure. Instead of a search, I can sort through everything alphabetically that Healthwise has. First gives you an option of clicking on a letter. So if I click on the F, I can probably find fibroids again. I can scroll down. Well, this isn't the same one I used before, but I can use this as well. You do have filters as well, an age filter and a gender filter. I like to keep mine on all because I don't like to filter anything out, just in case it's not filtering the way I would want it to, but you can certainly use these to help filter down the information. Next to the A through Z filter, you have a category search. So if you go to the select category drop-down, you can choose a category to use. And if I go to the OBGYN, I can see different options that are in here. And again, it works the same way. You just click on one of them, and it gives you the preview over on the right-hand side, and you can either choose to send or print it. When I'm done, I can just close the window by using the close button or the X. And you can see the documentation that I chose to have put on my progress note is showing up here in the treatment window. So here's from when I printed it the first time. Normally you're only going to be doing one of these. This is from when I sent it to the portal, and then the final one is from when I sent the other education to the portal as well. That's how you use the patient education in ECW. Be sure to check out our other videos.